When we think of threats to our health, most of us picture something visible, something we can point to and say, that's dangerous. But Legionnaire's disease is not like that. It is invisible, silent, and insidious. It doesn't spread from a cough or a handshake. It doesn't move the way a common cold does. Instead, it lurks in our environment, in the very systems designed to provide us comfort and convenience. And that's why it demands our attention, because the danger is often hiding in plain sight. This illness is caused by a bacteria known as Legionella, and its preferred habitat is water. But not just any water, warm, stagnant water where it can quietly multiply until it reaches a level where one breath, one mist, one inhalation of droplets can bring it into our lungs. Think about that for a moment. We live surrounded by water systems, air conditioning towers that cool our buildings, plumbing systems that bring water to our faucets, hot tubs that we use to relax, even decorative fountains we pass by in hotels or hospitals. All of these can harbor the bacteria that cause Legionnaire's disease. And yet, they look completely harmless. That's the paradox. We trust them because they're built into the background of our daily lives. Now, when we're young, perhaps our immune system can handle small threats like this more effectively. But as we age, or if our health is already compromised, the risk rises dramatically. Seniors, in particular, often live in environments where these systems are heavily used: retirement homes, hospitals, or apartment complexes. These buildings rely on large plumbing and cooling systems, and if those systems are not carefully maintained, the bacteria find a perfect breeding ground. The problem is not the water itself, but the way the systems are managed. Neglect creates an opportunity for disease, and when we combine that with vulnerable populations, we create the conditions for outbreaks. But the truly striking thing about this illness is how it doesn't need person-to-person contact to spread. It bypasses that entire route. Instead, it depends on the environment. That means, unlike the flu, you won't catch it from sitting next to someone on a bus. You'll catch it from walking through the mist of a poorly maintained cooling tower or taking a shower in a contaminated building. And so, the responsibility doesn't just fall on individuals, it falls on the institutions, the managers, the caretakers of the systems we rely on. Because if vigilance lapses, the results can be devastating. We've seen this in outbreaks across cities. A single contaminated cooling tower can infect dozens of people. A hotel hot tub not properly disinfected can sicken travelers from across the world. Hospitals, meant to be centers of healing, can inadvertently become sources of infection if water systems aren't rigorously monitored. And the cruel irony is that those who are already sick, the elderly, those with lung disease, or those recovering from surgery, are the most likely to suffer when a Legionella finds its way into their environment. Now, this might sound frightening, but the real message here is one of empowerment. Because unlike many diseases, Legionnaire's disease is preventable. The bacteria are not unstoppable. They thrive only in conditions we allow: warm, stagnant, neglected systems. With regular monitoring, cleaning, and maintenance, outbreaks can be avoided. The silence of this threat is not a reason for despair, it's a call for awareness. Once we recognize the enemy's hiding place, we are no longer blind. There is also something deeply philosophical about this. It reminds us that the greatest dangers are not always external. They are not always things we can see and fear directly. Sometimes, the greatest risks are built into the very systems we take for granted, and that forces us to think differently about health. Health is not just about the food we eat or the exercise we perform. It is about the environments we live in, the air we breathe, the water systems around us, the hidden infrastructures we seldom think about. To be truly healthy is to widen our awareness, to look at the unseen forces that shape our daily lives. So, when we talk about Legionnaire's disease, we're not only discussing bacteria in water. We are confronting a truth about modern living: that convenience without care, that technology without maintenance creates vulnerability. Our homes, our hospitals, our public spaces must be maintained not only for function, but for safety. Seniors especially need to be conscious of this, not in a way that breeds fear, but in a way that empowers them to ask questions, to expect accountability from those who manage the spaces they live in, and to take small steps at home, like cleaning humidifiers or ensuring hot water systems are used properly. What this all tells us is simple, but profound: health requires vigilance, even in places we assume are safe. The bacteria are silent, but silence can be broken with knowledge, with awareness, with the decision to never ignore what is unseen. And so, the next time you walk past a cooling tower, or step into a hot tub, or take that long, warm shower, remember this: health is not just about what you see, it is about what you don't. And by acknowledging that, by holding ourselves and our systems accountable, we protect not only ourselves, but everyone around us. Because sometimes, the greatest act of health is learning to see the invisible before it becomes unavoidable. When we examine outbreaks of Legionnaires' disease, one of the most revealing truths is how deeply connected they are to the environments we build for ourselves. The bacteria responsible for this illness do not emerge randomly. They thrive in specific man-made conditions, and those conditions reflect both our technological progress and our blind spots. Cooling towers, plumbing networks, air conditioning systems, these are marvels of engineering that make modern life comfortable. But when they are neglected, when maintenance is overlooked, they become breeding grounds for something dangerous. It is a lesson in balance. The very things that bring us comfort can also compromise our health if vigilance fades. Consider how these systems function. A cooling tower is designed to regulate temperature in large buildings, a feat that allows us to live and work in environments that would otherwise be unbearable. Yet, these towers also create the perfect warm, moist conditions for Legionella bacteria to multiply. The same goes for water tanks or pipes that aren't flushed regularly. Stagnation provides opportunity. A hot tub that isn't properly disinfected may appear crystal clear, inviting us in for relaxation, but beneath that surface it can harbor a hidden risk. This contrast between what is visible and what is invisible is at the very heart of understanding this disease. And here's where the psychological depth becomes important. Human beings are wired to trust what we can see. If the water looks clean, we assume it is safe. If the building is new or modern, we assume its systems are being monitored. That assumption is comforting, but it is not always true. Legionnaires' disease forces us to challenge this instinct. It teaches us that appearances are not enough. We must ask about the systems behind the surface. And that realization carries over into many aspects of health. Think about it, how often do we judge health by appearance? A person who looks well may be silently battling illness. A food that looks fresh may still be harmful. Legionnaires is just another reminder that health is not about appearances. It is about what lies beneath. Now, when outbreaks occur, they tend to make headlines because of their suddenness and severity. Dozens of people falling ill in a matter of days from something no one expected. It feels almost like a mystery novel. But when investigators trace the source, it nearly always comes back to environmental oversight. A system was not cleaned, a schedule was skipped, a protocol was ignored. And that points us to a larger truth. Many of the health crises we face are not born out of fate, but out of preventable lapses. This is why accountability matters so much, especially in public institutions, hospitals, hotels, senior facilities, places where trust is assumed, and where vulnerable individuals live or seek care. For seniors, this environmental factor is especially critical. As we age, our immune systems naturally weaken, and our ability to fight off respiratory infections diminishes. A younger adult may be exposed to the bacteria and never develop full-blown disease, but a senior with pre-existing lung problems or chronic illness may become gravely ill. So when we talk about environmental responsibility, it is not just a matter of good engineering, it is a matter of compassion and justice. It is about protecting those who cannot afford the cost of neglect. There's also a philosophical point to reflect on here. Legionnaires' disease reveals how interconnected we all are with the spaces we inhabit. Health is not just about what you do for yourself, it is about the systems and structures around you. You can eat the right foods, take your medications, stay active, and still fall victim if the air you breathe is laced with contaminated mist from a cooling system. That can feel unsettling at first, but it also reveals an empowering truth. Collective health depends on collective responsibility. We are not isolated beings. Our well-being is shared. This is why awareness becomes so important. Seniors, their families, and caregivers should not shy away from asking questions. How often is this water system maintained? When was this cooling tower last disinfected? Is the hot tub or humidifier being properly cleaned? These questions may seem small, but they can save lives. Asking them is not an act of paranoia, it is an act of empowerment. It shifts health from something passive into something active. When we look at Legionnaire's disease in this way, it becomes more than just a case study in bacterial infection. It becomes a mirror held up to society, showing us that neglect in the background leads to suffering in the foreground. It reminds us that our relationship with health must expand beyond the personal and into the communal, just as we would not drink dirty water knowingly. We should not allow the invisible systems of our environment to remain unchecked. And so, the lesson here is clear. The health of our environment is inseparable from our personal health. Outbreaks of Legionnaire's disease are not simply unfortunate accidents, they are signals, warnings that when maintenance slips, lives are endangered. Seniors in particular carry the greatest risk, but we are all touched by this invisible chain. The next time you walk into a hospital, step into a hotel lobby, or even turn on your shower at home, remember this safety isn't guaranteed by appearance. It is secured by awareness, by vigilance, and by the quiet, consistent work of prevention. And that means we must all play a role, asking questions, expecting accountability, and never assuming that invisible risks are beyond our influence. Because in the end, health is not only about what you choose for yourself, but about the hidden choices made in the spaces you inhabit, and those choices, when illuminated, can be the difference between illness and protection. When we talk about Legionnaire's disease, it's easy to focus only on the bacteria itself, the microscopic culprit that hides in water and waits for a chance to invade our lungs. But if we stop there, we miss the bigger story. Because the real issue isn't simply that the bacteria exists, it's that we, as a society, often fail to detect it early enough. And this failure comes at a devastating cost. Early detection and strong prevention are not just medical tools, they are the difference between life and death, between a contained problem and a widespread outbreak. Let's step back for a moment. Imagine an invisible enemy circulating in the mist from a cooling tower or the spray of a shower head. You can't see it, you can't smell it, and you won't even realize you've encountered it until days later when fever, cough, and weakness strike. By the time you feel the symptoms, the infection has already taken hold. That's the insidious nature of Legionnaire's disease. But here's the critical truth: while the bacteria may be invisible, its presence is not unknowable. Science has given us the tools to detect, monitor, and stop it before it harms. The question is whether we choose to use those tools consistently and responsibly. There's something profoundly philosophical in this. Think about how often in life our struggles grow not because the problem is unsolvable, but because it's ignored until it becomes too large. Legionnaires is a mirror of this human tendency. A neglected water system, a skipped safety test, a delayed diagnosis. Each of these is not simply an oversight, but an open door for disease, and yet the opposite is also true. A properly monitored system, a routine inspection, a physician who thinks to test for Legionella, these are small acts that close the door before the enemy even steps inside. Now let's consider prevention in practical terms. Regular maintenance of water systems, monitoring for bacterial growth, ensuring adequate disinfection. These are not luxuries, they are necessities. Hospitals, hotels, senior centers, anywhere large groups gather, must treat water safety as seriously as fire alarms or emergency exits. Because the truth is, contaminated air from a cooling system can spread much like smoke. One building can become the source of illness for an entire neighborhood. Prevention, therefore, is not just about protecting a facility, it's about protecting communities. For seniors, early detection carries even more weight. Older adults are more likely to suffer complications from this infection, and too often their symptoms are mistaken for something else, a common pneumonia, a seasonal flu. That delay in diagnosis can mean the difference between recovery and tragedy. Doctors, caregivers, and even family members must be vigilant. If an older person suddenly develops high fever, confusion, and cough, especially after being in a hospital or hotel environment, Legionnaire's disease must be considered. Here, awareness is prevention because naming the problem early guides the right treatment. There is also a psychological lesson here about attention. We live in a world overflowing with information, distractions, and competing demands. It's easy for maintenance schedules to be postponed, for safety protocols to be pushed aside, for subtle warning signs in a patient to be overlooked. But Legionnaires teaches us that attention is not optional. It is the most powerful form of protection we have. To pay attention, to look closer, to not dismiss what seems minor. That is how outbreaks are prevented. And when prevention succeeds, it's often invisible. No headlines celebrate the hotel that cleaned its cooling tower on schedule. No one applauds the hospital that tested its water and found nothing. But those quiet acts of responsibility are the very reason lives are spared. This challenges us to rethink what true success looks like. It's not always the dramatic rescue or the heroic cure. Sometimes success is simply the absence of disaster. It's the outbreak that never happened because someone cared enough to do the work no one sees. If we carry this insight beyond Legionnaires, it becomes a philosophy for life. Health is not something we protect only when crisis strikes. It is something we guard quietly, daily, through habits of attention and prevention. Just as a water system must be monitored, so must our bodies, our minds, and our environments. Waiting until symptoms explode into crisis is too late. The real power lies in catching the problem upstream before it has a chance to cascade. So, as we reflect on Legionnaires' disease, we are not just talking about a medical issue. We are uncovering a timeless principle: vigilance prevents tragedy. Whether it is a neglected cooling tower or a neglected lifestyle habit, what we ignore today becomes the danger of tomorrow, and what we tend to with care today becomes the protection of tomorrow. Here's the thought I want to leave you with. Health is not secured by luck. It is secured by foresight. Legionnaire's disease reminds us that prevention may not be glamorous and early detection may not make headlines, but together, they're the quiet guardians of life. And if we embrace that truth, not just in hospitals and hotels, but in our own daily choices, we will not only reduce outbreaks, we will reshape what it means to truly live in health and safety.